All right, thanks for joining us here on our Facebook Live. I am Cassandra Wallace with the Theta Care Public Relations team. I am joined by Dr. Zach Baseman, who is a family medicine physician in the Wapaka Wild Rose areas. Dr. Baseman, you're also our Associate Medical Director of Primary Care. You are many hats within Theta Care. We appreciate you taking the time to do this Facebook Live Q&A today. So really, Dr. Baseman, we did this before, and we want the community to be involved. Ask questions. We are tracking all the comments on social media. The questions that you are asking Dr. Baseman, we are going to try to get to as many as we possibly can so he can answer those for you. What are the questions that people are asking you, Dr. Baseman? You've had a lot of people reach out, giving you some of those questions. We'll get to those as well. So really, we want this to be an opportunity for the community to ask questions about COVID, about the flu, and about mental health regarding COVID and what's happening right now in our community. So trying to touch on multiple topics here. Dr. Baseman, first off, let's get started with talking about where we're at in the state of Wisconsin right now. Things have changed significantly over the past couple of weeks or month or so. So can you give us just a little bit of information about where we're at now?
Absolutely. Thank you for putting this on, Cassandra, and thanks to the community. This is a community ask. So this wasn't my idea to go out and do this. Community members have been asking for another session. So we're happy to provide this as part of our role as a population health organization. So a couple quick numbers and just stats, and then we can kind of get into the more interesting stuff for most of us with questions. But we've had a significant change in the status of the pandemic in Wisconsin. And what we are seeing are some of our checks and balances alarms saying, this is not going the way we hope it would. We are seeing increased numbers of community spread and cases, which has been the case all along. We knew that those were going to rise, but the real change that we're seeing right now is increased hospitalizations. And to be hospitalized for COVID is really just a matter of probability. So if hospital cases are going up, it means that the burden of community spread is great enough that we are seeing that uptick. So now is the time to really double down on the science as well as what we can do to protect ourselves and protect our communities. And we hope that this will help provide some of that. So the current state of our state is 119,955 cases that are positive of COVID-19, and there have been 2,367 new cases just recently in the last day. So we're kind of hitting this record number of new cases pretty consistently, and that's part of the change. Deaths in Wisconsin are at 1,300, and in the last 24 hours, we've had 17 new deaths in Wisconsin. If you look at overall our regions, so for north central Wisconsin, for the Fox River Valley, and for the Green Bay region, which is Green Bay and north, we are seeing significant upticks in hospitalizations. So in the last 2 weeks, we've nearly tripled our hospitalizations, and that's kind of all indicative of the community spread, and we're going to talk more about why that could be the case. For locally, I'm specifically here in Wapaka County and Wild Rose, which is in Waushara County. Activity is high in both of those counties. Wapaka is at 1,092 cases, 20 deaths so far. And Waushara County has nearly doubled their cases in the last couple of weeks, from 200 up to 372, with 6 confirmed deaths from COVID-19. So overall, what we're seeing here nationally is over 200,000 deaths at this point, which is just to put it into context, it's now the 3rd leading cause of death in our country, right behind cancer and heart disease, and it also is more than the last 5 wars we've had combined. So this is real. And early on when the numbers were low, is it real? Is it not real? Are we caring about this? Is it concerning? This is what we have at stake. For a death rate of 0.1%, which sounds low, but you have 350 million people in our country, and that's 3.5 million people that are potentially at risk. So that's the stakes of this game, and we hope to keep it very well contained.
All right, that's a really good update for us. Thank you, Dr. Baseman. Like we said, things have changed significantly over the past month or so. It seems like, there was a heightened awareness in the spring when all of this kicked off, a little bit of a lull in the summer, and now we're seeing this uptick in cases. So I think a lot of people are wondering why, what changed, What happened? What are we doing differently?
Yeah, and one of the things I'm hearing a lot is, with masks now being mandated, why are we seeing increases? Why is that? Why are masks not working? And the truth is, the masks are working. Things would be much, much different if we didn't have a mandate and people weren't wearing their masks. So, the reasons why we keep increasing are a couple of different things. It's complicated. There's lots of different ways that this is happening. Kids going back to school, particularly college-age kids, we know that this has been a population in our segment that has been at risk of catching this due to, socialization, not necessarily wearing masks, living in close quarters. Just recently, we've actually had a report from the New York Times saying 7 of our college campuses are now in the top 20 metro areas across the country for fastest spread of COVID-19. And that would include La Crosse, Whitewater, Platteville, Madison, Green Bay, Eau Claire, and Oshkosh. So now those folks are not at particularly high risk of having complications of COVID-19 themselves. It's very likely they have super mild disease. And that's one of the real things that's kind of the red herring with this particular virus, is that the majority of folks are going to have mild symptoms. And so making sure you take seriously a small sniffle or a sore throat for a couple of days as if it is COVID-19, because as our community spread increases, it likely is. So, for me as a younger person, I'm not worried about getting sick from COVID-19, but I am taking all the precautions I can because the person I give it to might get sick, and that's my responsibility. Plus, if any of my colleagues or any of my staff would get sick, we're not going to be able to deliver the health care that we are planning on delivering for our communities. So we have to really protect those resources, and our skilled healthcare workers are a really, really prime resource, and we can lose some of them for contracting illness, and that's where the community has to start to, play their role of helping us to be able to combat this in the public as a population health organization.
Thank you for that explanation. That's a very good point to make. We're going to get to more of that in just a little bit about how the increasing cases are impacting our system and our team members and the overall community. For people just joining again, we want to take as many questions as possible. This is your opportunity to talk to Dr. Baeseman, get some questions answered. What are you wondering? Is it about flu, COVID, mental health, COVID fatigue? What can we answer for you? So again, leave your questions in the comments. I am monitoring those and we'll get to as many as possible. Dr. Baeseman, when you talk about the community's responsibility here, what are the things that all of us should be doing? What precautions should we be taking every single day?
So these are the things that you've probably been hearing about a lot: wearing a mask, standard surgical mask or a cloth mask if you have it. That is super valuable. It's a super valuable tool, not only for me to protect you, Cassandra, so that I'm not spreading respiratory droplets when I'm out in the community or next to you, but it's also important because it can reduce my risk. Now, a lot of times I hear community members who I'm seeing as patients say, well, doc, the pores in those masks are bigger than the microns of this particular virus. And one of the things I love to say to them is say, take a bed sheet and pull it out and pour it full of water. And the water's going to come through it, obviously, because the pores are bigger than the water droplets are. But now take a bed sheet and you spread it out and toss a bucket of water at it. And most of the water is going to get deflected from that bed sheet. So it's not bulletproof. It is not a blanket of immunity that will protect you in all situations all the time, but it's incredibly useful for reducing your risk of contracting this virus. Now, there is also data that's saying the amount of virus you're exposed to is also predictive of how potentially severe symptoms you will get. So if I get a few viral particles in through my mask and I contract COVID-19, it's likely I might be asymptomatic, and it's likely I may only have mild symptoms. If I take a full cough from a patient who's contracted this in the face, it's much more likely, it's not a guarantee, but it's much more likely my immune system will get overwhelmed and start to get into these complicated scenarios with cytokine storm and other complications of COVID-19. So wearing a mask is useful. Social distancing is useful greater than 6 feet. And this has come up in the public a couple different times. If it comes down to one or the other, your mask is more important than social distancing. If you have to be in a crowded area, wearing a mask is more important than being 6 feet apart. Now, if you combine them, you have additional benefits. That's useful. If you combine them and you're outside, that's a third variable that you can influence with ventilation. But the order of preference would be mask outside, social distancing, and if you have to be in close quarters inside, social distancing, mask, as best you can. Washing hands for 20 seconds, happy birthday twice, or 20 seconds, super useful. Decontaminating common household surfaces or public surfaces that could have virus, also super useful. These are the things that, at this point are not rocket science, but we have the data to prove that they are actually useful and can influence this. Now, why are we increasing? Well, people are still having mass gatherings, and people are also not taking this so seriously. And I see a couple different ways that people rationalize this. I see people who have no experience with COVID-19. They've never gotten it. They know no one who's had it. And they say, well, it's not even here. I don't see it, so it can't be real. Well, I'm a health expert professional. There are plenty of others that are with me in this in lockstep. It's real. You have to take our word for it on that case. This is what we do for a living. This is what we've trained for decades to do. And this is a real scenario that you have to follow the guidelines to help us all get to the other side of this without a lot of additional destruction that we don't need. The other rationalization that I see fairly often is people who have contracted this, and they have mild symptoms, and they're surprised that their symptoms are as mild as they are, and they take their personal experience and they try to extend it to everyone's experience and having content expertise about all the different things that can happen with this, and it's just really false logic. Just because I've gotten away with something at some point in my life doesn't mean I'm a master at doing this particular task or whatever that might be. So as people do have small gatherings, which is appropriate if you're all sharing risk in a small gathering of a certain amount of people, it's so important to have the social pact to say if any of us get symptoms, even if they're mild, I'm not going to rely on a test and the public health department to do contact tracing. I'm going to take personal responsibility and let you know, hey, I got symptoms. How are you feeling? And doing kind of in so many ways your own contact tracing to be able to, make sure your contacts are safe and are not further exposing other individuals.
Very good information again for us. Dr. Baeseman, we're starting to get a lot of questions coming in. Again, we're going to get to as many as possible. I want to stick with the theme of masks because, this is something that you're hitting on right here. Dan is asking, are there any long-term health impacts of mask wearing? Is that different for children? And I want to also touch on what are the recommendations for washing masks and how often should we change those? So a lot in there. Again, long-term impacts of wearing a mask and how often should we change those masks?
Mm-hmm. So long-term impact of wearing masks is not anything that's going to put you at significant health risk going forward. So I do hear a lot of folks saying, well, it's about your immune system and I want a healthy immune system and I need exposure to bugs to be healthy. You're exposed to bugs all the time. You have bugs in your home all the time that you are exposed to, and you don't have to wear a mask in your home. But for this particular bug, in this particular moment, the risk-benefit ratio of helping your immune system to not get exposed with a large amount of virus is so important. And it's important for the reasons that I just said. The amount of exposure you have with a novel virus like this that you've never seen before, humans have not seen it before, does have the opportunity to turn on all the lights in your immune system, which is how you get in trouble potentially in the hospital. If your immune system's inflammation system goes haywire, those are some of the really bad complications that people can experience in the hospital. Now, if you have a standard cloth mask that someone made for you and it fits really well, or you've purchased one, I would say you should have a few of them and you should launder them at least daily. If you have a standard surgical mask or medical mask, those are intended for single use. They aren't intended to keep until they fall apart. So for me, I'll usually change mine out daily, but I won't be touching it on and off all the time. If it gets soiled, if it gets torn in any way, I will get a new mask and replace it.
I like what you said too about having enough cloth masks. When our children were in person for school, we bought, 5 or 6 different masks, and they knew every day when they came home from school, take the mask off and put it directly in the laundry. So for us, that was a way that we made sure that those were getting laundered every day and not using them for multiple times. So if you can maybe have multiple masks and just as soon as you get home, put it in the laundry so it's washed. We're getting, again, more questions in here. Bonnie, again, sticking with our theme of masking right now, she wants to know your thoughts about the different types of masks. Is one more effective than the other? And then what about nose guards? I know that a lot of people have them put in place there to be secure over the nose. Should you have nose guards in? And maybe talk a little bit about the fit, because we do see quite a few people with masks under their nose, under their chin, kind of falling off. So talk about the different types of masks and the secure fit.
Mm-hmm. So I think it depends upon the application. So, and that's really important to point out, because as a professional who is in the healthcare world, the equipment that I need and have to use every day because I'm in close contact with individuals as an essential worker may be different than the need in the community, because you may not have that same kind of thing. So, if you think about the NFL would never be expected to play at their level without helmets and pads. So, and that was an issue early on in the pandemic, where it was talked about using cloth masks for medical professionals. So to dispel some of that, the reason why is because we're in close contact with known positive people, potentially for an entire day, and we have a different level of protection. So for us, we wear masks and we wear pappers and cappers that have a complete seal. So it's sealed. The air that I'm breathing in and out has a great seal around, or it's encompassing my whole head, so that with pressure, being pushed through my helmet so that it comes out so I don't breathe it in. That's the standard for someone who's in close contact with someone who is in the hospital setting. For a standard surgical mask or a standard cloth mask that someone has made, I think that that's perfectly appropriate for community use as long as you're wearing it properly. So, I know everybody wants to take it off and get a quick breath, and if that's something that you need to do, get into an area where you're well away from other people, or you're outside, and take whatever couple deep breaths to kind of reset your, anxiety and level of stress, and put it back on and get back into whatever kind of situation you need to be. But it has to cover your nose, and it has to go around your mouth. Now, they don't fit tight, and that's okay. It's okay because it is still helping you knock down those respiratory droplets that come out of your mouth, and you still have a significant reduction in contracting this. And if you contract it, as we said before, it's much more likely you'll get mild symptoms even wearing a standard cloth mask. So as far as the nose pieces, all of that, take it or leave it. If you feel more comfortable wearing them, I would say go for it, because you should feel comfortable in the equipment that you're using, and you should feel comfortable in the knowledge you have and how to protect yourself. But for me, I wouldn't think twice about it. If I were going into a grocery store, if I were going into a gas station, I would wear my normal regular mask. If I have a surgical one or medical one, just because those are the ones I'm wearing all the time, I'd wear that. Otherwise, I'd use my cloth mask. And I would stay socially distanced from people as best as I'm able, 6 feet. I'd be mindful of my hands, not to touch my face, and I definitely would wash my hands as soon as I get out to my car before I even, do anything else or touch anything.
Perfect. Again, lots of questions, really good questions coming in here. Summer is asking something that I think a lot of us are sort of feeling right now. She's saying, with, such similar symptoms between the cold and flu and COVID, how do I know that a sniffle is just a sniffle? Should we be erring on the side of caution? And I really like this point that Summer made. She says she sort of feels like a hypochondriac. She's worried all the time when, you feel something that might be allergies, might be a cold. So talk a little bit about how we know what this is and how do we help maybe with that, some of that anxiety that we're feeling.
Mm-hmm. For me personally, I think, taking care of your wellness is really important. So if you're feeling anxious, if you're feeling like you're starting to get to be a hypochondriac or nervous about contracting this, then I would say this is the perfect venue for you to be, to ask your questions, get good information, and with good information, understanding the why. If we understand why we're doing the things that we're doing, you can take comfort in that, because you are managing your risk as best as you're able, and those are the parameters that are within your control. So we're going into cold and flu season, and there is going to be other respiratory viruses that are around, common cold things, rhinovirus, parainfluenza, influenza. There's a whole bunch of them. You have to err on the side of caution. If you have it and you think you have symptoms, then err on the side of caution. Quarantine yourself, make sure that you're not exposing other people. Call our hotline. There's a Theta Care hotline that you can get triage. There's also our symptom checker online that you can access through MyCharts. Those are very useful things to get you information about next steps if you're not sure. And if you're feeling okay, if you got a sniffle or a sore throat, but overall, like, I feel okay, I don't feel terrible, then be reassured that you don't feel terrible, because that's a good situation. If you start to experience chest pain or shortness of breath or anything like that, those are things that have to get investigated. So you should call our symptom hotline and also the symptom checker. Those are great ways to get triaged if you're not sure, or come in and get an appointment and let us check you out. That being said, it's really, really important, and we're relying on our community members for this part, because I can't be with you all the time, and your doc can't be with you all the time, and we can't be in your pocket, although we wish we could. It's really important that you seek the appropriate level of care. So if you have a sniffle or a sore throat, please don't come to the ER for something if you're feeling otherwise well. The ER is busy taking care of strokes, they're taking care of heart attacks, they're taking care of infections, and they're taking care of really sick COVID patients. So we don't want you there if it's not appropriate. Now, by all means, if you're sick or you are really concerned this is an emergency, come in and get triaged, get taken care of. But there are plenty of places you can access our system where you'll get the appropriate level of care. And our professionals will recognize when you need a higher level of care, and that is our mission to you, to make sure that we're getting you to the appropriate level of care.
Great, thank you for that too. I'm glad that you mentioned our symptom checker online, our community hotline that we have, and again, very good point about not showing up to the emergency department for, like you said, a sniffle. That's where we really want you to contact your primary care provider. Let them guide you to the best level of care for you at that moment. So again, resources are out there. They're available on thetacare.org's website. Again, lots of places that you can access that information. Some more questions that we have. This is very similar to our last question, but it's, pushing it a little bit forward. Dan wants to talk a little bit about COVID fatigue, mental health around COVID right now. Are there support groups out there for people who may be experiencing other effects from this pandemic? And for COVID fatigue, Dr. Baeseman, oh my goodness, we hear this all the time. We're all living this 24/7, it feels like. How do we break away, and why is it important to keep that in check for all of us?
Mm-hmm. We all, as human beings, have a propensity to have confirmation bias. And when we're in stressful times, it is easy to say, I don't know anybody who's sick. I just want to see my friends and have a normal night and, be able to hang loose and just have fun. And the thing about it is when people do that, they might have a situation where they never see COVID, and now they think that their risk is less because they got away with that. And part of managing your risk is really understanding why. This is just not going to go away. So the way that we think about it is, would I ever cross a busy street without looking both ways? Would I ever do that? And I wouldn't, and I would never let my kid do that. And I would always try to teach my children, or to teach, kids or me, always take the right normal steps. The normal way of managing risk when you cross the street is to look both ways. This is the normal way in a pandemic. And until we are officially to the other side of it, it is the normal way. And that has to be so routine in your lives that it is just muscle memory. Now, that doesn't mean you can't do things with other people. You just have to keep it small. You have to have this social pact with people that you trust, have the same level of risk that you have, and have the understanding that if any of us get sick, even if it's a mild symptom, I promise you, I will tell you what happened, and you'll tell me what happened, and we're agreeing to that being a possible outcome with our interaction, and that's okay. That's not wrong to do, especially if there are people within your circle of risk that have a really tight ship outside exposures, and you want to share that risk for your mental health, for your family's health, for whatever reason that might be. Now, there's lots of social groups that are out there, or other kind of nonprofit groups that can give you support. So if you're struggling with substance use disorders, NAMI is a great resource. There's a number of resources in the Fox Valley. I couldn't even begin to list them all off. They have hotlines. There are Facebook groups. There are local Facebook groups for talking about a lot of the different stresses of our world, aimed at a very small sliver of information of, talking about pandemic concerns, talking about masks. You could start one of those kinds of things. If you didn't have one otherwise, getting regular exercise is so important. It's so important to get regular exercise. I have this sign right up there on my door that I put up there during this pandemic, and it's a beautiful tree. It's a wood sign, and it says gratitude, Sonder, curiosity. And when I'm feeling stressed, I try to reframe it in that context. I'm grateful for my health today. I'm grateful for the opportunity to be able to serve my community today. I'm grateful for the patients that I'm able to see and care for. Sonder is a concept of understanding other people's lives and understanding that other people's lives are as complicated as your own. That's a difficult concept for us in our society to grasp these days in the political decisiveness and all of the stress that we have. But it's super important. And then the other thing is being curious about this. Can I influence the population's health by doing a Facebook Live? I have no idea. I have no idea whether this will be helpful for you or not, but you know what? I'm curious about it, and it's worth trying, because being curious is what keeps us engaged and helps us to be human.
Love it. Be curious. I love that. Again, Facebook Live, Dr. Baeseman, thank you for all of these questions. We're taking more questions. We have a lot coming in. We're going to get to as many as possible. Please, everyone, leave your questions in the comments. I'm monitoring them off to the side. We'll get to as many as possible. Dr. Baeseman, let's stick with that theme of mental health just for a second. I want to know your thoughts about what a positive attitude, how important is that at this time?
I think it's really important. It's important to be positive, and if things seem overwhelming, and they do for me too. I'm a normal person, just like all of you listening to this. I get overwhelmed at times as well, and when I start to feel that way, I take my circle and I get it down smaller and smaller. What part of what I am in control of can I get involved with, get engaged with, and have agency in influencing? And I can do that with my health. I can do that with my exercise. I can do that with my diet. I can do that with supporting my family and friends and patients and community, and the circles just get bigger and bigger from there. But it's important. It's important to have good information so that you can feel confident in what you're doing to manage your risk, and from that you can feel pretty good about that. This is the standard practice. This is not anything super fancy. We are all capable of doing the things that we listed just 10, 15 minutes ago for managing our risk, and in that you can feel really good. Other things as far as, feeling good, if you feel like you have a handle on your risk, how can you help out in your community? Are there elderly folks in your community that you can engage with in one way or another safely and say, hey, can I get groceries for you? Can I do something to help? Helping other people always makes us feel good. It just does. It just fills our bucket. It makes us feel so good. It's a great way to get a positive attitude if you're feeling really down.
Good suggestions for us. All right, Dr. Baeseman, let's move on just a bit here. We're talking, again, COVID, but we're also taking questions as we move into flu season. This is coming up. We see this every year. Let's talk a little bit about how important it is to get your flu vaccine, and what are the consequences of having these, two situations going on at once, flu and COVID. We've heard it referred to as a twin-demic potential. So again, important aspect of flu vaccines, what are we facing? And maybe also talk about the risk of contracting COVID and the flu at the same time, because like you've mentioned before, that is a possibility.
Sure. Flu shot is so important. It's important anytime. And one of the things I hear from patients a lot that are resistant to getting their flu shot is it doesn't work, or I got sick, or I got flu anyway and it didn't help me. The flu shot is not intended to prevent you from getting any influenza. The flu shot is intended to prevent mortality. So that's a really important thing. Some vaccinations are good enough to prevent disease entirely so we do not see it anymore. Polio is a great example of that. But not all vaccinations can get to that level. And so when we can't prevent disease entirely, what we're really shooting for is limiting the disease so that people have less symptoms. So in that second week of getting influenza and you're really getting, you're worn down, you're tired, you're not sleeping, you've had fever for, a week, so that you don't get that secondary bacterial pneumonia to cause a mortality event. That's when influenza gets really dangerous, is when you've had it for 2 full weeks or a long period of time, or you have lots of underlying medical conditions, and the severity is long enough that you catch something else on top of it, and that's where it gets really dangerous. So the influenza shot is important for preventing mortality. Now, when this all came out with twin pandemic, I think some of this is media sensationalizing what we have in front of us. And a side note that we can talk about a little bit later is limit your news. I mean, get what you need to know so that you are adequately informed of what you need to do. But please don't watch the news for 24/7. You will not learn anything new that you didn't get in 15 minutes of really solid coverage, and you're only going to increase your anxiety and stress. Back to influenza. So when this first came out, I was like, as a clinician, I'm like, well, I'm not really that concerned about influenza and COVID at the same time, because if you're washing your hands, if you're wearing your mask, if you're social distancing, all those things are going to prevent influenza as well. And we have testing with our rapid testing that can test for all the common colds, influenza, and COVID-19 in one test. So it's like, well, we're going to know which channel someone's on, and the treatments are different. So the treatment for influenza is very different than the treatment for COVID-19. So it is really important to distinguish these two. Now, as this has evolved, and we've just kind of seen where we've been, where we're going, and where we're currently at, one thing that's become a really critical issue is our supplies and testing. So in the beginning of the pandemic, we did not have tests for COVID-19 for an extended period of time. While we were all staying at home, we couldn't test you and know an answer for 7 days because it was a send-out. We had nothing in-house because this stuff wasn't invented and we didn't have it yet. So as this has happened going forward, supply chains are tenuous. As places are surging around the country, everybody has super high demand for these tests. And one thing that we've seen, and we keep very close track of it within our organization, is what is our supply of PPE and what is our supply of the reagents for testing. And we have waxed and waned. There's been tests that we've lost for a little while and then brought back online as soon as they were available. So the reason why I say this is because it is very, very important to get your flu shot. Because if we're all doing the right things, which is not happening by evidence of our increased hospitalizations of COVID-19, we can handle both at the same time. But if the pandemic isn't going well, it's also right for influenza. Now, luckily, we have not had any influenza activity that I'm aware of in our area or in our state yet. But it's so important to take one variable out of it by getting your influenza shot, because if we run out of tests at any point, I can't predict the future, I hope it does not happen, but if it does happen, we could be blind. And that means we're relying on either send-out tests or tests that take several days, which could delay treatment of influenza or COVID-19, depending upon which you have or if you have both. And that's really critical, because the sooner you get treatment for these things, if you're really sick, the better off you're going to do. So that's really important. It's important for all of us, as we said in the very beginning, to all do our part. If we're all doing what we need to do to take care of our communities, our people, all of us, as a community, and as your healthcare organization, as at ThetaCare, we're asking to partner with you and do your part, because all of that will help us so much in delivering really high standard of care, and that is what we're aiming at. We want to deliver the highest quality care that the world can provide for you with these new diseases and with any kind of disease, and we can do that, but we need your partnership with it. We need people to wear masks, to take all the precautions that we need. There's one other thing about that. You can catch both. They're both separate. You could definitely contract both influenza and COVID-19. And obviously you're going to be at risk for some complications if you have any underlying health problems, or even if you're healthy with both of those things going on simultaneously.
Great. I'm going to take a couple of questions here that we're getting. This is sort of a double question here. Julie wants to know, is there any data about someone being immune to COVID after testing positive? Paula also had a similar question. Can you get COVID twice? So I guess really asking about COVID immunity. Once you've had it, is that it? Can you get it again?
We don't know. I mean, we've only had this around now for 9 months in the world. So we're trying to figure this out as fast as we are able. The last that I have read, we have immunity, at least measurable immunity. How effective that immunity is another question. But we have antibodies for at least 3 months, most likely for most people. Now, not everybody will seroconvert and have immunity that's lasting. It depends upon the individual person. It depends upon their level of exposure. When we talk about vaccines, some vaccines are one and done. And we know that once we give you the vaccine, you have lifelong immunity. But that's all rigorously studied. And so when there's a series of 2 or 3 booster shots, we know that in order to get people the lifelong immunity that we need, they need several exposures in order to have the antibody T cell memory to be able to pull that up whenever it's needed again to be able to fight off an infection. So it's not very clear. There have been case studies of people getting this thing twice. It's generally been healthcare workers taking on incredible exposure. So as we said before, the amount of exposure you have, it's not a be-all, end-all, but it is partially predictive of how severe of symptoms you might get, just like underlying medical diseases such as obesity, diabetes, if you're on any immunosuppressive medication, if you have chronic lung disease, all those things are also predictive of getting really critically ill. So to be determined. One of the things with a vaccine, which I'll just kind of jump into this vaccine conversation because I'm sure there's questions about it, is, once we have a vaccine, is it safe? That's the first thing. And then is it effective? And with it being effective, how many shots do you need to be able to be covered for the season that you need? And that's an open question. And if you look at any vaccination, it's different for every vaccination. You actually have to go through the motions of studying it, which takes time in order to be able to have an educated opinion and recommendation about how many shots you might need for lifelong immunity. And these questions, I mean, we're talking about how quick can we get a vaccine? These questions it takes the time to elapse in a study and then compile the data to be able to have a recommendation. So keep in mind, this COVID-19 vaccination is literally being developed faster than any vaccination has ever been developed in human history. Let that sink in. That's faster than we've ever done this before. And so if we're going to do it fast, which we'd like to, we want to get this done fast because we want this out there to the public, we have to make sure we go through the proper channels of all 3 phases of trials and phase 4 after it's been released so that we can have the best information to say to our population, this is safe, this is effective. Because if we start bypassing those kinds of things, what we will rely upon is an immune reaction database, and there is this for all vaccinations. So there is a database that if someone has some kind of a bad reaction and they think it could be due to a vaccination, it gets compiled in this database and then reviewed over time about, is this connected, is it not, do we need to restudy this? Well, if something gets bypassed and it's not safe and we find that situation, my professional concern as someone who has, as a clinician and as a public health background, is that if something comes out too soon and it's not safe, we could lose vaccines as a public health intervention because there is more resistance to vaccinations than there's probably ever been before. And we really need to trust the science. And in order to trust the science, we have to let the science go through the process that it has to go through with the professionals and the scientists that are actually doing it. So more to come with that. I think that we will probably get a vaccination. It's likely. It's not a guarantee. I mean, there's 100 labs around the country right now, around the world, with over $100 billion going into developing this thing. So one of my other reservations, just food for thought, is, with all the money going into this, there is going to be a winner when it comes to market sooner rather than later. And that's even more reason why the checks and balances and proper channels of going through the process that has been established as the gold standard of all of our vaccinations has to be maintained. And so the American Medical Association has an independent task group right now that's not involved with pharmaceuticals. It's an independent task group that's saying we want to look at the data to say this is safe and to give our recommendation on it as an independent observer of the data. And those kinds of things are critical. Those kinds of things are critical. So once we have a vaccination, provided we do, it's not going to be available until well into next year, mid to late for the public. I mean, you're talking about 100 to 200 million doses of this thing, getting it to scale. There's definitely processes right now that are going through. If we do have some early vaccine, who should it go to? Obviously, essential workers of all varieties would be, higher on the list because of the exposure that they're going to be taking on, especially if there is a surge type of situation. And so, it's not the pie in the sky thing to say, hang your hat on. We have to use the tools that are available to us today. And a mask is a great one. And social distancing is a great one. We can get through this without a vaccination, doing all those things, social distancing, washing your hands, wearing a mask. And we have to be prepared to be able to get through this without a vaccination using those tools, because it's not a guarantee we'll get that vaccination. And when we get it, great, hallelujah, things will hopefully move faster and we'll get to the other side of this better. But until then, we need to plan ahead. And the tools that we have right now are adequate to get this thing under control.
Thank you for talking through the vaccine questions. I'm sure that we will, like you said, be seeing a lot of those there. And like you said, we have tools right now available to us that everybody in the community should be using: masking, washing your hands, socially distancing. Dr. Baeseman, I have a question here from Dan. He wants to know, can young children give COVID to their parents? Which, yes. And why don't children tend to have more severe symptoms? Why is it when children, contract COVID, it's not as severe?
It's a great question. I'm not sure I'm going to have an answer to everyone's satisfaction on this one, but I can tell you what I know. Smaller kids, as far as young school age, are more likely to be asymptomatic or have really mild disease. Now, of that, there's a small sliver, even less small, smaller than young healthy adults, of having something really bad happen. Early on, the concern was that they could be vectors for asymptomatic spread, be kind of the perfect channel for this thing to get out in the communities. What we're seeing is they aren't the super spreaders that we initially potentially thought they were. Now, does that mean a young kid can't contract it and take it back to their family? They certainly can. It certainly can happen. They're not likely to get very sick, and their spread is likely to be less. So it's less likely that you're going to contract it from them. Now, as you get to older school age kids, middle school, high school, college, these are where the vectors are. I mean, this is the most common pathway right now in our current pandemic that community spread is happening. And they have an immune system that just happens to be ripe for being able to get this, surmounting enough of immune response, or not, being mild, and spreading a virus. So the virus is, really happy with a teenager. It can reproduce and replicate quite quickly. Now, this is different for every kind of scenario with vaccinations, and this is why the studies and the science have to happen. If you look at something like the human papillomavirus and the vaccination we have to prevent cervical cancer as well as head and neck cancers from that virus, younger kids do better with the vaccination. They only need 2 shots. If you're an older kid or young adult, you need 3 shots. And why is that the case? I don't know. It has to do with where the virus works on our immune systems, where we are developmentally with our immune systems. And so, you can't say because of all these viruses, this is the way that it is. That's actually really dangerous to do. We have to know for sure, because every virus has its own weak spots, its own strengths, and it's designed perfectly to do that in the way that it does. That's how it works.
Good. I have a really sweet question here from Paula. She would like to know about hugging her grandkids. She says it's been a while. She hasn't seen them very often. I think that's something a lot of our older people in the community are feeling right now, that, just being distant. She wants to know, is it okay to get a hug from grandkids if they've been taking precautions and they're masked? Dr. Baeseman, weigh in on that.
I think you have to make an individual educated decision for you, the risk you're willing to accept, and the needs that you have for your own personal wellness with your family and your grandchildren and your children. So, if your kids are across the country, which a lot of people are, it's not an option, really, for most people. If your kids are in your community and everybody has this shared understanding, and this is where, if you're going to pool risk and you're going to share risk with other individuals, you have to have a conversation about it. Everybody has to be in agreement of what they're agreeing to and what the potential outcomes are. And, if you are generally a low risk person, you don't have significant health conditions that would put you at a lot of risk for complications of COVID-19, and you have a really tight ship, you're following all the guidelines, you're not taking on extra risk, and your children and grandchildren are doing the exact same thing, and you want to pool your risk so that you can have contact or have a full contact weekend and nobody's had symptoms leading up to this, that might be for an individual a very reasonable choice to make. Not having 50 plus people, obviously, but keeping it in a small group of people that you have, contacts, you can talk to all of them if anybody gets sick, it might be reasonable. If you are quite frail or, there's real serious complications with either age, obesity, diabetes, chronic lung disease, you may not want to do that because the risk may be too much. Now, if you take it now another step further, and we talked about this just a little bit in the first question and answer, let's say that someone is a bit older and it's an end of life situation. And, for me personally, if I'm looking at an end of life situation because I'm in my upper 80s or 90s or upper 70s and have health conditions, and it's a matter of I want to see my grandkids and I may never be able to do that again in another calendar year before this is all kind of potentially cleared up, then I might make a quality of life decision as long as I can do it responsibly and not then spread to other people, taking responsibility if I would contract any symptoms of COVID, making sure everybody's kind of pre-screening, saying nobody has symptoms, nobody's had any recent contact with known COVID people. That might be a reasonable decision too, and so I can't say, one size will fit all for everyone, but the main themes will be shared decision making among the people you're sharing risk with, shared plan of communication and potential outcomes, and making the best decisions you can managing your risk.
It's a difficult decision. You did talk about that last time. You have to weigh all the risk factors and everything that goes into it as a family. So good advice there. We have about 10 minutes left in this Facebook Live. Again, trying to get to as many questions as possible. If we don't get to your question, we're going to try our best to answer after. Dr. Baeseman, I do want to stick with the family theme as we are talking about kids and hugs and all of that right now. And then we do have a couple more questions here. But one question I want to talk about that we keep seeing a lot right now is regarding Halloween. It's a holiday that we're, as parents, you want your children to experience something as a bit of normal. Can you tell us a little bit about the risks and other recommendations? And I guess, what are other things that we can do as families to give our children kind of a sense of normal?
Mm-hmm. The traditional Halloween trick-or-treating door-to-door is just not a safe option. You have no idea what kind of exposure those folks are having. You're going up to their door. Halloween, there was a whole safety protocol to start with, checking your candy, making sure there isn't anything that shouldn't be in there. So now those risks are too great to potentially do this the traditional way. That being the case, we could still have Halloween parties that are virtual. There's all kinds of social media platforms. For example, house party. Something where you could have a group of people having a socially distanced virtual Halloween party, and with that you could have all the costume contests and all the dressing up, and potentially trying some scavenger hunts at home for candy, or there's all kinds of creative ways to potentially not miss out on this traditionally really fun kid experience. So by all means, I think there are other ways to do it, but the traditional way of doing this, especially right now with our community spread at what it is and our hospitalizations going up, it's just, there's no way that this is a safe reality for people.
Okay. Again, trying to get to as many questions as we can, the few minutes we have left. Joni wants to know, how long does COVID, the virus, how long does that live on different surfaces? Things like clothing, countertops, grocery carts. What do we know about that?
So the studies that we had were done in a lab. They weren't exposed to ambient or real life conditions. And so some of the initial information we had was saying that this stuff could live on surfaces for quite some time. In reality, it depends upon what kind of exposures this has. It can stay there for some time, but it's not days and days and days and days. So generally speaking, having a process for it. If it's something that's cardboard or paper, it probably isn't going to live on it for very long. If it's something like a clean counter surface, something that metal, things like that aren't exposed to sun or weather conditions, it could last there for a day or two probably, which is why wiping down surfaces, especially in public places, is very important. Obviously, if lots of people are touching it, you need to be wiping those things down with some regular frequency. Having a process, if you're going to be in a big environment where you're going to have exposure, healthcare worker, I have a process for when I go home. I wear clothes, I change clothes when I get there, I get in scrubs, I have all these extra layers on top of me as far as the normal protective equipment, and I have a process of getting rid of all that and showering, if I'm in the hospital, before I'm going to expose my family to that kind of stuff. So it really depends upon your level of exposure. For normal exposure, routine life things, going to the grocery store, all that, just wash your hands and don't touch your face. And if you're really nervous, you can let things sit for a while or shop early in the morning when they haven't had any contact for at least 24 hours. Much more likely a lot longer. They've probably been sitting there for a day or two potentially on a shelf. And if that makes you feel better, that's fine. But I don't think you have to be worried about touching things that are in your house if you know all the people in your house and they're all doing the things that they should be doing.
Good. All right, we have, I think, time for one more question. Patrick, I think, gave us a really great question to end on here. With Wisconsin being a hot spot right now, what happens next over the next few weeks? And I think this goes back to Dr. Baeseman. What are we asking our community members to do right now for each other, for themselves, for our healthcare systems? We're seeing a significant increase in cases here. That's no surprise to anybody who's been following the data and our numbers recently. So what happens next for Wisconsin, and what are we asking our community members to do?
Right now, we're asking that you follow the guidelines that you've been hearing about for 9 months now. So wearing a mask, social distancing, washing hands, wiping down common surfaces. Those things right now are more important than ever before. This is now at a turning point in the pandemic, and we are now in what could be the new epicenter for the country. And that means we all have to do our part. We are making adjustments regularly to be able to accommodate whatever we need to accommodate, but there are limits to what we have. We only have so much people power, and so our staff need to stay healthy, and they will be healthier if it's easier for them to do the things they need to do in the community and not contract this. So for most of the exposures that people have been having that are healthcare workers, they're getting this in the community. They're not getting it in their work environment where potentially they're using all the things they should. And these are things that we look at constantly to be able to make adjustments and inform people, but we need everybody to do their part. If the community steps up and does their part, we will be able to get to the other side of this without all the scary things that we potentially have seen on the news over the last 9 months. And we need your help. We can't do it by ourselves. We are doing the best that we can, and it is phenomenal what our organization has put together in the last 6 months. We are nimbler than we've ever been. We are making adjustments faster than we've ever made them before. And we are doing the best work we possibly can to help take care of our communities. But we need people to do their part. So another aspect of that is get to the right level of care. If you can help us get to the right level of care, and we will assist you. We're not saying you're on your own. That's not at all what we're saying. Use the resources we have literally built for you. We built these for you. We didn't buy them. We didn't get them anywhere. We made them. We made them for you to use. And if you can get yourself to the right level of care, that'd be useful, because right now, at this present moment, don't need extra people in an emergency room for non-emergency things. We need our emergency room physicians and staff to be doing the work that they're trained to do for the people who really need them right now. And having ERs congested with people with a sniffle because they want to test, that's not useful, and it could be harmful for other people. So please do your part, and together we're going to get through this. I promise you that. We're going to get through this, and we can do it. We have the tools we need right now. We have them, and we know what we need to do. So now it's just a matter of applying them. The last thing I would say is give the Sonder part of that sign that I said. People are working with all different kinds of factors and all kinds of information. Be the example. Be the change you want to see in the world. Just be it. Just be that. Do what you can do, everything you can do to manage your risk and to help your family manage their risk and your neighbors if you are able and capable. And that's how we're going to get through this. By leading through example, people are going to start to change their behaviors because they're going to have to. And that can be done in an easy way, proactively, or it can be done in a hard way where, there's a correction that they're going to have to experience.
All right, very good information, Dr. Baeseman. Thank you very much for doing this for us and answering our questions. Again, tried to get to as many questions from our viewers as we could. If you'd like to leave more questions, Dr. Baeseman, me, or a member of our social media team can try to answer those for you as well. Again, thank you to the community for taking part. Thank you for all you're doing as well. We'll try to do another one of these very, very soon. Thanks so much, Dr. Baeseman.
Sounds good. Thanks, Cassandra. Stay healthy, everyone. Thank you.